This is a lipo burn following liposuction in a patient who had a BBL. Hi, it's Dr. William. Welcome to another episode of Behind the Mask. Today I want to be talking to you about another complication. This one is called Lipo Burns. But I'm going to show you it's not really a burn exactly. It's more of what we call ischemia. And ischemia is a lack of blood supply. You can get a burn from liposuction if you're using heat. So something like J-plasma or ultrasound or smart lipo where there's a laser, that can actually produce a burn because that's giving it off heat when you're doing the liposuction. But the type of liposuction that I do is traditional liposuction. And so it's technically, if you have a burn, it's not really a burn, it's ischemia. I'm going to show you why here. I made a couple little schematic diagrams here just to show you. So let's get started. So if you look here before liposuction, what you'll see is this area here is the skin. All of these two layers here. This upper layer is what we call the epidermis. And this thicker layer here is called the dermis. Now below the skin is where you have the fat. Underneath the fat is where you have the muscle. So where we get into problems with blood supply, which is what produces what people commonly call the lipo burn, is from liposuction through this area. These are all the fat cells. So if you look in here, this is all the fat. Below the fat is the muscle. And you'll see that the main blood supply to any of the skin throughout the body runs down in this deeper layer here in the muscle. And then there are what we call perforators, which are blood vessels that come above into the fat, and then they form another little network, a little highway, if you will, that comes up here, and then there are little roads that come up to supply the skin with blood. That's what delivers oxygen to the skin. And so here are all the fat cells. So when you do liposuction, we're removing those fat cells. We're also interrupting the blood supply. It has to happen because you can imagine as we're going through here with the cannula and removing those fat cells, some of those blood vessels are going to be broken. That's why you have bleeding after liposuction. That's why you have bruising after liposuction. That's what a bruise is. A bruise is the blood that's underneath the skin, and so you can see it through the skin, that dark pigmented color. And so these vessels can and do get broken during liposuction. So let's look after liposuction. So here we are after liposuction. So same areas. This is your skin here, two layers of the skin. This is your fat layer, but look at how all the fat cells now, most of them have been removed. We have to leave some behind because it's normal to have fat underneath your skin, above your muscle. But here's where the problem occurs, is it's right here where these blood vessels get broken. And when these blood vessels here get broken, you will have an interruption of the blood supply to the skin. And when that blood supply to the overlying skin is broken, is when you have problems with ischemia. So it's not really a burn, it's an ischemic event, meaning the blood supply has been interrupted. And so when this blood supply here has been interrupted, you will have problems with the skin will die. And that's what generates a lipo burn, is this area of skin will die. Now, how bad will the lipo burn be? Depends on how badly the injury is to the blood vessels. And so if you just have one little blood vessel here, you may get a little dark patch on the very top in this epidermis, in this epidermal layer. You may have a little dark spot. That will just slough off and that'll heal and that won't leave a scar. If there's been more blood vessels that have been injured with the liposuction, then what you'll find is there's a deeper level of ischemia. And with a deeper level of ischemia, you'll get a bigger wound. And so there'll be a small area on top which is black, but it'll go down and deeper, and you'll lose part of the dermis as well. That's a typical lipo burn. Now, when patients talk about lipo burns, I think they assume something went wrong, something happened that was, erroneous. And I mentioned this before. Complications happen after surgery. They're known complications. It doesn't mean something went wrong. It just means that by operating during that time, even though you're doing good liposuction, everything's going on the way it should go on, you can have enough injury to those blood vessels that you cause a burn. And so it's not common, but it does happen. I certainly have patients that have had burns in the past, and unfortunately, I know that I'll have patients who will have burns in the future. That's the nature of operating and doing liposuction. Now, we always try to be careful. Every plastic surgeon tries to be very careful when we perform liposuction, but even with careful, meticulous liposuction, depending on the anatomy of the patient, if you don't have as much blood supply, you can have these problems. Okay, so where do you typically get lipo burns? Well, you typically get lipo burns where you have naturally, just with the human body, lower blood supply areas. And it's mostly in the flanks. So this is from the front. So the flanks are in this area. And then if we look in the back, it's the same area. It's over here. And the reason is that there's poor blood supply in the flanks is because it's the furthest away from the blood supply. So the blood supply in the body is typically from the middle on towards the outside. And so if we look at the front, the blood supply comes down here. Remember, your heart is over here. The blood supply comes down here, and then it's coming out to the flanks. So that usually happens away from the center of the body in the flanks, because the blood supply is coming from the heart, it comes down the middle of the body, and then it goes towards the sides. And towards the sides is where you have lower blood supply. It's what we call a watershed area. Same thing happens in the front as it does in the back. The back, the blood supply is coming from the middle, it's moving to the flanks. So in the area of the flanks is most likely where you'll experience a lipo burn, because that's naturally where the blood supply is the lowest to begin with. And I'm just going to draw a little schematic here showing that here's the blood supply coming from the front to the flanks, and here's the blood supply coming from the back towards the flanks. And so you have this area here which is naturally has lower blood supply. And with that natural lower blood supply, a lesser injury, a smaller amount of injury to that blood supply during the liposuction is more likely to produce ischemia and give you a lipo burn. So that's why lipo burns are more common in the flanks. How do we treat lipo burns? There's not much to do from a surgical point of view. It's all wound care. And so it's usually just soap and water, and then some type of ointment on top. We usually prescribe either bacitracin, or if the lipo burn is more extensive, then I'll use a Silvadene. These are things that we use to treat burn patients, and I think that's probably where the whole term of a burn came from. And so just clean the wounds with soap and water. We apply either bacitracin or Silvadene, and then allow the body to heal. Remember, the body has been doing this for a very long time. It knows how to heal. We don't use any alcohol, hydrogen peroxide, witch hazel, nothing like that that could contribute to making the burn deeper. We only use soap and water and use the ointments and some gauze and allow the body time to heal. Remember, it takes about a full year for all of that healing to happen. And it takes a full year to get the color back. A lot of times the wounds will start off fairly pink, and then you need the cells to come back in and produce pigment to be able to get a normal skin color in that area. Hey, thank you very much for watching. I really appreciate it. Please go ahead and leave a comment below. I use your comments, I read them, and I use them for future video ideas. So if you have an idea for a video that you're interested in, please leave a comment below. Remember to subscribe my channel and also turn on the bell for notifications. I make videos frequently. My job is to educate you. I want you to be educated and informed prior to having plastic surgery. Thanks so much for watching. See you next time.